So hi friends, we're going up to the OT floor. This is the fourth floor of our hospitals here in Bangalore. So I'm going to show you the OT complex now, and we're going to show you a quick round of the facilities that we have here. On this side is a minor OT, a minor operating theater. I'm going to show you that at the end. And on this side is our ICU. We still don't have our signages. That's going to come up very soon. So as you enter in, on this side is our first room. And this is where we're going to wash up. I'm going to show you the sink and everything. So this is where we wash. So you can see it's all foot operated. So you get the soap and you get water, and three people can wash in at the same time. And this is the place where the clothes, where we want to change, and the sterile clothes are here. And we have two change rooms. So one for men, another one for women, he and she. Have a nice view. It's bright. Once we wash and once we scrub up here, so we come in, we change our clothes there, and then we come into the main OR. So in here we have three rooms, three OT suites. So I'm going to show you the first one now, and then there's a second one, and then there's a third one. So we have first OT here. So we're going to start a case soon. Our team's all waiting, ready for the case. So here we have the anesthesia machine, the cautery machine on that side, and this is one of my favorite stool. It's comfortable. It goes up and down, and so you can get nice view when you're operating. My loops are there. Then we have the other equipments here. All right, these lights turn on. Oh yeah, so our anesthesiologist is pointing on the fiber optic equipment. So Dr. Ningle Cholanga, he is going to tell us something about this quickly.
This is a fiber optic bronchoscope which you use for difficult airway. So this can be used for patients with anteriorly placed larynx or mouth opening. There is no mouth opening, TMJ ankylosis and all. So it's best thing available today in the world. I'll just show you how it functions. So we have got a video light source at the end of this one. So this can be manipulated and negotiate with the vocal cords and it goes inside. So once we confirm the position, we railroad the tube already inside. We will push the tube inside and this is taken out.
Yeah.
Yeah.
Yeah, so back here, I just quickly went to the other OR. So we're going to show you the OR2 now. This is our main OR. And so we're finally going to show you the dirty corridor also. And here I'm going to explain the. So here we have the panel. We didn't explain in the other OR. So here you can turn off the light. I mean, you have a lot of controls, the operating time, anesthesia countdown, blah, blah, everything goes in there. This is for our scans. So, yeah, we need to turn it on. So that's for the scan. Then we have some machines here for cutting. This is the cautery machine. We have a lights here. So I said this is a very large OR. So we've got ample space. We have a defib right here in the corner. That's a defib. Yeah, and we have the lights come up now. I'm going to show you the lights here. So we have two beautiful striker lights. These are our Mindray machines, state of the art, ETO2, everything attached. The saw machine is right down in the corner. We're not going to use. And in those suitcases, we have a couple of more machines. These are drill machines, saw machines that we use to cut bone, piezo, all of that in there. And then we have a trolley here. These are all the sutures that I've arranged very easily. The ones that we use commonly, the 50 Rapids, 50 Prolines, all the sutures, gloves go in there. And the crash charts have all of these arranged by my team. So this is the main OR when we have to do a major bi-jaw, craniofacial, other surgeries. We like to do it here. Or we're also going to show you the third OR now. This OR is not completely ready as we are shooting right now, as we're taking this video. The anesthesia machines are going to come, but you can see it's a very beautiful stainless steel OR. And again, you have these pendulum. Oh, yes, I forgot to mention about the static pass box in all the OTs. So what happens here is the instruments that are autoclavable or that needs autoclavable, and she's going to show us how this works. So you wait for the UV light to be off, and then the blower is active, and then you open it. And then what happens? You get the instruments that are used from the surgery, the unsterile ones, and they go here. That's picked up from outside. And then we have a lift, and that goes down to the basement for the CSST. CSST is a department when all of those instruments that are being used are washed first, and then they're sterilized. All right. I like this OT for another reason, because we have nice, beautiful view here. You get fresh sunlight, a nice view on that side. All right, let's go back out now, and we're going to show you the ICU. Again, these are lights. I think I showed you already. Okay. So I showed you the way we came in. So we came in like this, remember? And this is all the sterile area. So now I go back this way. So we're going back now the way we came in. And right here, as we entered, is our minor OR. So this is the fourth operating theater. So this is basically used for infected cases, patients that have some infected implants, or they have some infection or something else where we would want not the main OR to get infected. All right. And then we move on to our ICU. So our intensive care unit, it's got two divisions. The first is for the adults, and then we have a PICU for pediatric cases. This is the trolley that we're using to move the patient in and out of the OR. And before I go into the ICU, I'm going to show you a corridor on the back. So this is the dirty corridor. This goes on the back of the three ORs. And remember, I showed you that box, the static box through which we're putting the unsterile instruments and soiled clothes. So that goes on the back corridor towards the lift. All right. Now, this is the ICU. So we have, I think, about 9 beds in the main ICU, 10, and then 3 in the pediatrics. And 1, 2, we have a patient here. We're going to plan surgery for him later today. And so this is 1, 2. Okay, hello. And there's another patient there. The nurses are doing something. So there's one more there. There's another bed there. So all of these are beds. And then we have here. So this is going to be the PICU. It's going to get closed. But for the moment, we have 3 beds here. And that's the ventilator. I'm going to show you the pediatric ventilator. So this is the pediatric ventilator that's there in the PICU. That's the syringe pump. So this is the setup for the ICU. So we are able to manage most of the complicated craniofacial cases, complicated jaw reconstructions, long surgeries, face makeover surgeries, because we have a very good intensive care unit. We also have a lot of these paneling that's coming up that will be done in the next few days as well. And also you will see the signages are less at the moment. We're just few days after we've started. So there's still a lot of work that needs to happen. Fortunate that we have a good team with us. So everything is going on smoothly. All right. So that's a gist of our walkthrough in the OT complex. As and when time provides, I'm going to try and show you different other parts of this hospital. If you have any queries, do ask us. We're more than happy to answer you. Thank you and bye-bye.